There is a small gland inside the male body that most men never think about until the night they wake up for the third time needing to use the bathroom. It sits quietly for decades, doing its job without complaint, and then somewhere after 40, it starts sending signals. A weaker stream, a sense of urgency that shows up out of nowhere, a feeling that something has changed, even if nobody can quite explain what. So here is the question we are going to answer today, calmly and honestly, without the scare tactics you have probably seen elsewhere. What actually happens to your prostate as you age, and does something as simple and private as ejaculation frequency really change the outcome? Before we get to that answer, it helps to understand what this gland actually is, because most men carry it around their entire lives without ever picturing it. The prostate is roughly the size of a walnut, tucked just beneath the bladder, wrapped around the urethra like a ring around a hose. Its job is deceptively simple. It produces a fluid that nourishes and transports sperm, and that fluid makes up a surprising portion of semen itself. For the first few decades of a man's life, this gland barely registers. Then biology starts to shift, and the very tissue that once quietly supported reproduction begins to grow in a way nobody warned you about in school. That growth has a name. Doctors call it benign prostatic hyperplasia, and it is one of the most common conditions in aging men, affecting a majority of men by the time they reach their 60s. It is not cancer. It is not a death sentence. But it is the reason so many men suddenly find themselves standing at the toilet at 2 in the morning, waiting longer than they used to, wondering if the stream will ever fully start. As the gland enlarges, it squeezes the urethra passing through it, and that squeeze is what creates the frustrating trio so many men eventually recognize: difficulty starting urination, a weaker flow than they remember from their 20s, and the maddening sensation that the bladder never quite finishes emptying. If any of that sounds familiar, you are not broken, and you are certainly not alone. You are experiencing one of the most predictable biological transitions a male body goes through. Now here is where the story gets more interesting, because this is the part almost nobody discusses openly, even though it touches nearly every man's private life. Does how often a man ejaculates, whether partnered sex or on his own, actually influence his long-term prostate health? For years, this was treated as folklore, the kind of thing whispered between friends with no real evidence behind it. But researchers eventually decided to actually study it properly, and what they found reshaped the conversation entirely. A large-scale study published in the journal European Urology followed thousands of men over nearly 2 decades, tracking their reported ejaculation frequency alongside their long-term prostate cancer risk. The results were striking enough to make headlines in medical circles. Men who ejaculated at around 21 or more times per month showed a meaningfully lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. Read that again, because it runs counter to almost everything cultural taboo has taught men to believe about this topic. Regular release was not linked to harm, it was linked to protection. So why would something so simple make a biological difference? The leading explanation researchers point to is often called the flushing hypothesis. Each ejaculation clears fluid out of the prostate, and along with that fluid, it may help clear out cellular debris, potentially harmful byproducts, and low-grade irritants that would otherwise sit and accumulate inside the gland over time. Picture a pipe that only gets flushed occasionally versus one that gets flushed regularly. Stagnant buildup creates the conditions for irritation and inflammation in almost every organ system in the body is one of the quiet precursors to disease. When the prostate clears itself more frequently, it may reduce the opportunity for that slow simmering inflammation to take hold. But before anyone runs off treating this as a loophole, a free pass, or a cure, we need to pump the brakes here, because that would be a dangerous oversimplification. This single behavior is not a shield strong enough to cancel out poor diet, chronic inactivity, ignored checkups, or genetic risk. Think of it less like a magic key and more like one gear inside a much larger machine. It matters, the research is real, but it only works as part of an entire system of habits working together. A man who ejaculates frequently but smokes, eats poorly, avoids exercise, and skips every doctor's visit is not protected. He is simply one variable ahead in a race he is still losing on every other front. Which brings us to the deeper biological story. Because frequency of release is only one thread in a much larger pattern of change happening inside the body after 40. There are three major shifts worth understanding, because together they explain almost everything men experience as they age. The first shift is structural. As the prostate enlarges through benign prostatic hyperplasia, it does not just grow, it becomes less efficient at fully expelling its own fluid. That inefficiency creates a kind of internal congestion, a persistent low-grade pressure that many men describe as discomfort without being able to pinpoint exactly where it is coming from. Left unaddressed over years, this kind of chronic congestion is associated with ongoing inflammation, and chronic inflammation has been linked in study after study to a wide range of long-term health complications, not just in the prostate but throughout the body. The second shift is hormonal, and this one surprises most people the first time they hear it. Testosterone, the hormone most associated with youth and vitality, actually begins a slow, natural decline as men age. At the same time, the body converts a portion of remaining testosterone into a different, far more potent hormone called dihydrotestosterone, often shortened to DHT. DHT is significantly more powerful at stimulating prostate cell growth than testosterone itself. So paradoxically, even as overall testosterone drops, the prostate can still be pushed toward enlargement because it is DHT doing much of the driving, not raw testosterone levels. This single fact explains why so many men are confused when they hear their testosterone is normal or even low, yet their prostate keeps growing regardless. The third shift is cellular, and it is simply a numbers game built into the nature of aging itself. Every single day, your body replaces old cells with new ones through countless divisions. Over decades, across billions of these replications, the statistical odds of a copying error occurring somewhere in that process quietly increase. Most of these errors are harmless and get corrected automatically. But combine that rising probability with years of low-grade inflammation and hormonal shifts already reshaping the tissue, and you start to understand why age itself becomes one of the single greatest risk factors for prostate cancer. This is not fear-mongering, it is simple biological math, and it is exactly why proactive screening becomes so important as the years accumulate. Here is a truth that deserves to be said plainly, because so much of the internet either exaggerates this topic into terror or buries it in awkward silence. Prostate cancer, when caught early, is one of the more manageable cancers a man can face. Survival outcomes for early detection are strong. The single biggest factor working against men is not the disease itself, it is delay. It is the years men spend avoiding a conversation out of embarrassment, hoping symptoms will simply resolve on their own. Silence is not protection. Silence is often the very thing that allows a manageable condition to progress into something far harder to treat. So let's talk about what actually helps in real, practical terms without vague platitudes. The first pillar is consistent medical monitoring. Starting around age 40, or earlier depending on family history, especially if a father or brother has had prostate cancer, men should be having regular conversations with a physician about prostate screening. This typically involves a simple blood test that measures a protein associated with prostate activity, alongside a brief physical exam. Neither test defines a man's worth or masculinity. They are simply data points, the same as checking blood pressure or cholesterol, and early detection remains the single most powerful tool in successfully managing prostate-related disease. The second pillar is nutrition, and this is where science offers something surprisingly specific and easy to apply. Diets heavy in processed meats, fried foods, refined sugar, and excessive red meat have consistently been associated with higher inflammation markers throughout the body, including in prostate tissue. On the other end of the spectrum, diets rich in vegetables, fruit, and healthy fats like those found in olive oil, avocado, and nuts are associated with lower inflammatory activity. And then there is one ingredient that keeps appearing again and again in the research, almost humble in how ordinary it is: the tomato. Tomatoes contain a powerful antioxidant called lycopene, and multiple studies have linked higher lycopene intake to better prostate health outcomes. Interestingly, cooking tomatoes, rather than eating them raw, actually increases how much lycopene your body can absorb, which means something as simple as tomato sauce, tomato paste, or a rich marinara can quietly be doing more for your long-term health than most supplements marketed for the same purpose. The third pillar is movement, and it does not require anything extreme. Studies consistently associate moderate, regular physical activity, roughly 30 minutes most days of the week, with better hormonal regulation and lower systemic inflammation. Strength training in particular has been shown to help support healthy testosterone balance as men age. And there is one specific, almost invisible exercise worth knowing about: pelvic floor training, often called Kegel exercises. These movements strengthen the muscles supporting the bladder and prostate, and they can be done silently anywhere without anyone ever knowing you are doing them, which makes them one of the easiest health habits to actually stick with long term. The fourth pillar is hydration, deceptively simple and deeply underrated. Adequate water intake, generally in the range of 2 to 3 liters daily depending on body size and activity level, helps dilute urine, supports smoother urinary function, and assists the body in naturally clearing waste products. It will not undo years of poor habits on its own, but as a daily baseline, it quietly supports everything else on this list. What is striking when you step back and look at all of this together is how much of prostate health comes down to ordinary, almost boring daily choices rather than dramatic interventions. There is no single secret ingredient, no hidden trick, no shortcut that replaces consistent habits sustained over years. The gland that will define so much of a man's comfort and confidence in his 50s, 60s, and beyond is being shaped right now, today, by what ends up on his plate, how often he moves his body, how much water he drinks, and whether he is willing to sit through 15 uncomfortable minutes in a doctor's office once a year instead of years of silent worry. Maybe that is the real takeaway here, more than any single statistic or study. Health, especially the kind we are too embarrassed to talk about, rarely fails because of one dramatic moment. It erodes slowly, through years of small avoidances, until avoidance itself becomes the risk factor. The men who age well are rarely the ones who found some secret. They are usually just the ones who stop treating their own bodies as something too awkward to check on. So maybe the real question is not what your prostate needs from you. Maybe it is simply asking whether you are finally ready to stop looking away.